In the cath lab, we're all seeing procedures get more and more complex, and with that complexity naturally comes a higher risk of radiation exposure for us, the operators. So how can we better protect the team? Well, a 2018 study in the Indian Heart Journal looked at one potential solution, the RADPAD radiation protection drape. Let's break down exactly what they found. The study really boiled down to one critical clinical question. When you're dealing with these high-risk PCIs, what more can we do to protect the operator, above and beyond the standard shielding we already use every day? And to answer that, the researchers zeroed in on the most challenging cases, the ones where radiation exposure is a real concern. We're talking multivessel disease, tricky bifurcation lesions, left main stenting, and of course, chronic total occlusions. So here's the setup. It was a randomized controlled trial involving 65 patients. They were split 1-to-1 pretty evenly, with 35 patients in the group that used the RADPAD and 30 in the control group that did not. Now, this is a crucial point. Both groups use the full standard shielding protocol. That means lead coats, thyroid shields, and a ceiling suspended shield for everyone. This design was really important because it isolated the one variable being tested. The RADPAD was strictly an addition to our existing best practices, not a replacement for them. And here's what that intervention looks like in practice. You can see the sterile drape is placed directly on the patient. What it does is create a barrier to block scatter radiation right at the source, basically between the image intensifier and the operator. Okay, so how did they measure the effect? The primary endpoint was something they called relative operator exposure. The formula was the operator's dose in milliram divided by the total radiation dose in gray. And to keep things consistent, the dosimeter was always placed on the operator's upper left chest, right underneath the lead apron. Before we get to the main result, let's look at the procedural variables. As you can see, the fluoro time and the total radiation dose were statistically pretty much the same between the two groups. The p-values were 0.871 and 0.198, nowhere near significant. This is important. It tells us the cases themselves were well matched in terms of how much radiation they were putting out. All right, so with those factors controlled for, the results were incredibly clear. The relative operator exposure was significantly lower in the RADPAD group. It dropped from an average of 2.27 down to 1.39. This was a really solid finding, with a p-value of 0.004. So what does that number mean in practical terms? It translates to a 39% reduction in the operator's relative radiation exposure. That's a very clear, very impactful result. The study also confirmed something many of us have suspected. They had a key secondary finding. Left anterior oblique, or LAO views, emitted significantly more radiation per shot compared to non-LAO views. And you can see that difference was highly significant, with a p-value of less than 0.001. So what's the big takeaway for our daily practice? The data really shows a significant cut in operator radiation exposure. And it's a reduction that holds up no matter how long the procedure takes or how complex the case is. The study's authors summed it up simply and directly, and I'll just quote them. The RADPAD significantly reduces radiation exposure to primary operators during prolonged, complex PCI cases. It really reinforces the value of this as an important tool to add to our standard shielding.